What's up, guys? I'm Dr. Webb, orthopedic spine surgeon here in San Antonio, Texas. I am between surgeries. I heard you guys have some questions for me. Let's go answer them for you.
Hey, Dr. Webb, what first sparked your interest in medicine?
Yeah, that's a great question. It was a medical magnet program in high school that got me interested in medicine, and that program is the reason why I'm a doctor today. It was called the Fairpart Medical Careers Magnet Program.
So, Dr. Webb, what has been one of your greatest personal challenges?
One of my greatest personal challenges is actually just juggling everything. The work-life balance, trying to figure out, how do you balance family, surgery, being a busy surgeon, and also just having a social life. That's been the greatest challenge that I've come across.
How do you unwind after a stressful day?
I think it's important to take a couple of minutes to just reflect. I always try to see what could I have done differently for a surgery or for a particular day. What improvements can I have done? But usually just hanging out with my little ones, and also just taking it easy, relaxing on the couch, kicking back, taking it easy. Really, that's what I do.
What hobbies do you enjoy in your free time?
I love working out. That's 2 or 3 times a week for me, 5:30 in the morning. And I also enjoy watching basketball, sports, going to sporting events, and traveling. I love to travel. I've been to probably 14, 15 countries, and that's kind of one of the things I love to do is travel.
Dr. Webb, how has your perspective on life changed over the years?
Well, I've become more just grateful and humble to actually get to this point, to be able to do what I do as a surgeon, to be able to help patients. I think that's something that I've kind of learned to appreciate over the years.
All right, Dr. Webb, what's an area of your life you're working to better understand?
Just trying to figure out what's the next steps. You spend so much time actually getting to this point, 15 years of school and training, then you get here, like what's next? I'm always trying to get to the next point, try to be better, try to be a better person, better father, better surgeon, teacher, leader, and I'm honestly not sure what's next for me.
So how would you measure personal success?
Personal success is what you determine is important for you. What are your values? What are your goals? It's something that you've achieved. For me, is being able to make a difference in people's lives.
Hey, Dr. Webb, what role does your family play in your life and career?
Well, I think family is extremely important. I mean, you have to have a support system. You have to have, someone, that's really why I work so hard. And what I look forward to going home is my kids when they come up screaming after a long day at work. And it sucks that you have to make a lot of sacrifices, but plays a really important role. My wife is very supportive, and kids, that's what keeps me going.
Okay, so what's the hardest decision you've ever had to make in your medical career?
Wow, that's a great question. I think the hardest decision actually is knowing when not to operate on patients. You have patients that come to your office, they're in severe pain. They come in, they have their whole level of their spine, every single level is degenerated and collapsed down and stenotic, which is tight. But some of these patients have a lot of risk factors for surgery. And that's the hardest part, is telling the patient you're just not a really good candidate for surgery because the risk of surgeries are too high. And I struggle with that.
What do you hate most about your job?
I hate dealing with insurance companies and kind of dealing with getting approvals, denials for surgeries, patients that have obviously pathology, that have things that we can improve in surgery, but for some reason insurance companies, they don't take the whole picture into account. They don't look at the patient, they don't see the patient. Their initial responses for denials, to deny a surgery, and we have to fight, get on the phone. It takes a lot of work and also a lot of time and effort to actually get approval for a patient. So dealing with insurance companies is what I hate the most. And that's what I hate about my job. But about to get started with this case here. I hope you guys enjoyed the questions. I got some work to do, so catch you guys later.